Welcome to the Organic MD podcast with Dr. Damon Miller, and I'm Carlisle Koash. Welcome back to our ongoing discussion about health and wellness and doing things to improve all of these things for yourself. How are you today, Dr. Miller?
Hi, Carlisle. I'm actually pretty good today. I mean, we're still in sort of a crazy time in the world, but it's good to be here. We're talking here about things that you do to maintain your health, and boy, if ever there was a time when you need to be attending to that, it's now. But I just wanted to say that today we're going to be talking about the next in what will eventually be a series of 8 different podcasts that all relate to the Better Eye Health program, the program we do working with people with serious eye diseases, retinal diseases like macular degeneration, Stargardt disease, retinitis pigmentosa. And we're talking about those because we have a pretty effective program for helping people with those. I just want to name and honor Grace Halloran, who was the woman, Grace Halloran, PhD, the woman who was sort of the pathfinder and the person who put the ideas of this program together. But just, you hear, when people get diagnosed with these problems, these diseases, it's a pretty consistent story that you hear that they're told, they come in, they're having trouble with their vision. Maybe they've got a family history and they kind of figured out that they are affected too, but they're told you've got a very serious disease. The problems you're having with your vision aren't going to be helped by a new pair of glasses. And we don't have anything to offer for that. If the doctor really is not in the right space, they might say there's nothing you can do. And it's not true that there's nothing you can do. You need to know.
It's the diagnostic hex or curse, I think, right? I'm trying to remember the...
Yeah, people actually call this medical hexing when a doctor tells someone there's nothing you can do. You respect the doctor. If they say there's nothing you can do, there must be nothing you can do. And if they were really going to be honest, what they would say is that I don't have anything to offer you. There's no drug or surgery that I know of that's going to help this. There are some vitamins that might slow it down. I'm going to recommend those to you, but you're not going to see any improvement in your vision as over the course of your life. And we work with people all the time that improve their vision. And we're here just to kind of keep hope alive, but also let you know what do you need to do if you want to salvage your vision, keep it from getting worse, and even regenerate some of the vision you've lost. And so the point of today's podcast is basically understanding that the things that you hear about that are offered by ophthalmology, by modern medicine to treat, to quote, treat these diseases, unquote, really are just treating the complications of these diseases. So the disease that has the worst problem with complications is macular degeneration. Everybody starts out with dry macular degeneration, but as the degenerative process goes on in the retina, eventually you reach a point where the structure of the retina starts to break down, the vessels break down, you get leaking and bleeding into the retina, and now it becomes wet macular degeneration, or more formally exudative macular degeneration. And doctors have developed some very interesting treatments to try and stop that bleeding, because the bleeding and the leaking can be very destructive. So they inject drugs like Avastin and Lucentis and a few others, Eylea, that they have to inject, take a needle and inject it directly into the eye. It does stop the bleeding, but it does not treat the underlying problem. And so you stop the bleeding, but you don't treat the underlying problem. People's eyes just continue to get worse over time, which is what they were doing, before the injection. And if you read that 17-page informed consent, a doctor doesn't put a needle in your eye without doing a very thorough informed consent. And, it says very clearly, because it has to, that this is not intended to improve your vision. And if you do see any improvement in the vision, because we treated this big problem with the bleeding, it's not intended for that to last. So Um, yeah, and it's just the whole thing of, I mean, you've seen this in the work you've done in hospitals. I know that the medicine treats in Oriental medicine, it's referred to as the root and the branch. You can treat the root of the disease, or you can treat the branch, which means treating the underlying causes or treating the symptoms. And that's what Western medicine does mostly, is go after the symptoms.
Well, because if you're in pain or in a lot of discomfort from those symptoms, you don't want to have them going on forever, right?
Right.
You want a quick solution, and I think there's nothing wrong with the temporary solution to help reduce something or to at least make it a little more manageable. At least my work doing palliative care, if someone's in so much pain that they can barely speak, then just getting some of that pain managed. So the age old thing was just often someone would be in so much pain that they weren't sleeping or they hadn't been getting sleep. So not only are they in a lot of pain, but also they may have not slept well for weeks. So that adds then even more, discomfort and disorientation. And, sometimes we would find a person being able to get even like several days of good sleep. They felt better. They felt, okay, I'm not as depressed. I'm not as,
Right.
but at a certain point, it's then, okay, we've gotten this figured out, but now let's look at what's really going on. And can we do something, can we do something else? But I think what we see is just that first step. So I'm giving you this medication. If you just take this medication the rest of your life, you won't have issues with your cholesterol anymore. Just continue doing what you want to keep doing. Um, I remember my dad, who was overweight, had gallbladder problems. And the doctor was like, "Oh, this is going to be easy. We're just going to take out your gallbladder and then you can just keep eating the way you're eating." And my dad was like, "Oh, well, okay. But it feels like maybe there's some there's some other issues. I am overweight. I will acknowledge that, but I do love the really spicy foods and the really, the nice French
Mhm.
cheeses and stuff. Like he did like his food, you know, but he also didn't feel well and he had a terrible fear of surgery. And so his thing was, what else could I do? And the doctor, from how he shared it, the doctor was like, well, I mean, you could change your diet and do this other thing and take lecithin and, you know, cut down on these things. But why do that? I can just pull your gallbladder out. And you can just keep, chowing down. He would have been dead, years ago if that was the case, because he would have continued in a diet that would have killed him easily.
Yeah.
Um, and so he didn't do that. He changed his diet. He lost over 100 pounds and was very healthy the rest of his life for the most part. Um, so it's that thing of, oh, we got this quick fix and you can just keep doing what you're doing, as opposed to, yeah, this is an issue. So here's what I suggest. You really need to change your diet. You really need to get more exercise. I mean, we're seeing it more. That is being suggested more to people, but I still see people who their diets are, not very good. They have these issues that if they made these fundamental changes and dealt with the roots, yes, it's a little more hard work and you got to give something up a bit, but you're going to live a better stretch of time.
Right. Yeah. And we're gonna come back and talk in another podcast about diet as it relates to the eye disease. But yeah, no, that's perfect, and it's true. What you're talking about with your dad, and what I'm talking about with people with complex degenerative eye disease. The thing that's common there is that there are things you can do. They take effort, they take time, they take change in diet and lifestyle and work, um, but they work. And one of the things that I want people to be clear about is that I have ophthalmologists who are treating many people that I treat. They see people get better, and they don't suddenly say, well, gee, I want to be doing that, because that's just not what they do. Modern medicine, not just eye doctors, but modern medicine has kind of in getting swallowed up by this corporate model, doctors barely have time to spend 15 minutes with you. That's what they're allowed
Hmm.
in the clinics they work in. That's not time to sit down with you and go, here's this complex program. Let me walk you through it. Let me stay in touch with you to keep you motivated and on track. The doctor who told your dad about, yeah, you could lose some weight or you could do this, but don't, I'm not going to be able to help you with that. I'm not even sure I know how to do that, but how to help you with that. But that's going to take a lot of time, and if you decide to go down that route, you're on your own. You're going to have to find help somewhere other than in the clinic. And so, but that's what we do here. We do here with the Better Eye Health program is we show you what to do. We give you the support you need, and then we watch you get better and take a lot of pleasure in that.
I also
So,
think that the Western medicine approach is outcomes based. So the treatments that have been over time shown, if I have a wound, a stage 4 wound, there are X, Y, and Z procedures to make that wound better. It's very clear. I have this to start with, and if I do this, this, and this, it should get me to that result. And I think the thing with the Better Eye Health program, as an example, it isn't just one thing. It's several things that you do all at once. And in conjunction with each other, they're very effective. They support each other. And you could pull one of those things out and it wouldn't, disturb things. But, we sometimes have folks who say, oh, I just want to do this part of the program. Okay. And it may be effective, but it won't be as effective unless you do all of these things, because the body and the system is complex, and sometimes you need to do a conjunction of things together. And could you just say, oh, if I just exercise it will get me the result? It might, but it will likely be more effective if you add this and these other things.
yeah,
And I think Western medicine, it doesn't function that way. It wants to know the outcome of everything you're doing, so that, well, to some extent, so that it can be billed for, and it has there's a whole structure in place for sometimes why that is. But naturopathic approaches, aren't usually doing that, or Eastern medicine. I've gone to plenty of Tibetan medicine practitioners where they're reading subtle channels of energy and working with herbs, and it's a practice. Here's a collection of things. Try this, boil it, drink it as a tea. Let's see how it goes for 2 weeks. Okay, it's not quite working, or it's working. Okay, let me add this thing. It's an ongoing process so that we get a best solution, but that
yeah.
takes patience and time.
Well, and that's what we tell people, because we've been doing this for decades now. Is that if you do everything we ask you to do, and there are different pieces, and we'll talk about that in another podcast, but if you do everything we ask you to do, the odds of your seeing real improvement that lasts are 90%. And that's because these pieces are all synergistic. They do work with each other. You can't get that result by doing just one or the other. You got to do them all. And yeah, it takes some time, but we're talking here about your vision. This is most people, when they kind of think about it, they go, yeah, it's worth doing whatever it takes to maintain my vision. I lose my vision, I lose my autonomy, I lose my ability to drive, I won't be able to play bridge, I can't see my grandkids' faces. It's a big deal losing your vision. And we're just saying there are things you can do to maintain and even improve the vision you've lost. You just have to do them. BetterEyeHealth.com is where you can go if you want more information on the program itself. But we'll come back in another podcast and talk about that. So so basically, just to wrap it up here, Better Eye Health, it's a program that will preserve and restore vision. It is a bit complex, but it's worth it because we're talking about preserving and restoring your vision. And it's something you do yourself at home. You don't need to travel to a clinic 4 times a year to receive expensive treatments. So I'm really happy with the way that works. And so when you're ready to get started, we'll just follow some of the links that are on the page for the podcast. Anything else you can think of, Carlisle?
No, I would just say that even if you're listening to this and macular degeneration or an eye issue is not something that is of concern, there are things that we're talking about here that is an approach you could apply to
Sure.
many other things. I think fundamentally shifting how you look at yourself and how illness or things arise in us, and that kind of approach can be applied not just to the eyes but to other things. And so there may be ways in which just listening you are inspired to see things in a different way, or to address an issue that you might be dealing with in a completely different approach.
Yeah. Well, one thing I, the way that my practice is set up, my medical practice, works with that. One thing I didn't really mention is that these injections and things that they do into your eye for the complications for the eye disease actually have some pretty significant downsides. There are some rather nasty side effects that come with repeated use of these drugs, and they need to be used repeatedly. It's an invasive procedure. It has to be done over and over and over and over and over again, and then over and over and over again. And so it's
that's a lot of overs and agains.
That's a lot of over agains, yeah. And so there are downsides to that, and we're offering that there's a program that actually works on the core of the problem and is safe. And so the way my practice is designed is that, unlike the way a lot of Western medicine is practiced, kind of putting what you just said into another light, that when you have multiple choices as to what you can do if you've got a problem, at least start with the ones that are safe, because those may work. Those tend to be the ones that are going more after the root of the problem. And, like your dad found, he changed his diet because that was suggested to him as something that might help. He lost weight. And did he dodge the surgery?
Oh, he did not. No, he hated surgery. Terrified him.
Okay.
So yeah, terror. I mean, he did have terror helped fuel another choice, but hey, he.
Yeah. And
you got to go with.
A lot of people, their relationship with their doctor is that if the doctor says, I need my gallbladder out, let's do it tomorrow. And
I know I have friends and some family that have macular degeneration, and because their doctor, and they know who I am because they're part of family, and I've said I'm happy to talk to them, about this stuff. And no, my doctor says, nope, we're not going to do that. Like you can't do that. And so, okay, that's what my doctor says.
Yeah. Well, we're trying to spiff up and beef up the testimonial page, because we got so many people who've had good results with this and they're willing to share. So, you can go hear about, maybe once we get 100,000 testimonials, maybe then people will change their mind. But anyhow, I think that's good for today with this. So I just want to thank you.
Oh yeah. Thank you. Okay. So this is the Organic MD podcast, and please keep listening and subscribe and check out the website, and we'll see you all soon.
Thank you.